President Duterte has yet to decide on the IATF's recommendation to continue using face shields in indoor and outdoor settings. Let's discuss that and other issues with Special Advisor to the IATF, Dr. Ted Herbosa. Good afternoon, Dr. Herbosa. What's the IATF's policy on face shields for now? What is the standing policy, just to avoid confusion?
Good afternoon, Sean. So this issue on the face shield has been discussed and debated. The recommendations of the people from the expert panels in the technical advisory group is actually to be able to continue to use the face shield in enclosed spaces like hospitals, like malls, or even in public transport, in the LRT, MRT, in the bus, and in the jeepney, to be able to use the face shield as an additional protection. However, if you are in open spaces, open fields and open spaces with little people, you may opt not to use the face shield. So that's the current guiding principle of the experts. But we'll still leave it up to the president to finally decide based on whether to let go of the face shield or not. But the experts are saying it's an additional protection, especially with the Delta variant, or the double mutant variant from India that is now going around the US, the UK, and hopefully not yet in the Philippines, but I know it's an additional layer of protection that we can give to the Filipino people.
Right, and exactly, just to dovetail off of that, 13 cases of the more infectious Delta COVID variant have been detected here in the Philippines. Now, we know, Doc, that there is some sort of delay because genome sequencing is not, an instantaneous process. Having said that, is there reason to believe that there could be community transmission coming up? And is this also one more reason why the IATF is recommending to maintain or to still retain the use of face shields indoors?
Well, as of now, Sean, as you said, only 13 cases of the Delta variant have been identified among returning Filipinos. That means these were Filipinos who have actually traveled, who had come from abroad, arrived in the Philippines, had the swab and was positive, was quarantined, and then they were tested negative before they were released because they had symptoms. So there were 13 of them. I think majority of them, 10 of them were seamen working in the ships. So they were what we call all imported cases. As of today, there is no proof of community transmission of the Delta variant. So that's our stand. We've not found it among the samples that have been tested by the Philippine Genome Center. So as of now, all our cases, the 13 cases, are actually imported. Unfortunately, one of them passed away from severe COVID. So that's how dangerous it is. Even the UK has delayed their opening up of their economy because of the 90% of their swabs or samples were actually of this variant.
Right, and having said all of that, should we revisit our COVID-19 protocols and all other protocols with travel in the light of the detection of this variant here in the Philippines, or are we okay with the standing protocols?
Well, I agree with you. There is some level of pandemic fatigue. There are people around the country that are probably relaxing our minimum public health standards, and this is based on the fact that we have increasing cases in the Bicol region, in the Western Visayas region, and the Mindanao region, also in the Cordillera Autonomous Region. So these are the proof that we need to continue to be vigilant, behave correctly, behave wisely, and then get our vaccines. Right now, there are already 14 million doses that have arrived in the Philippines, and many of our colleagues have already received their vaccinations. So it's very important that we get our vaccination once the vaccine is available in your local government.
All right, at this point, Doc, allow me to circle back about what you were saying about the testing protocol for arriving passengers, since this is the way that we are catching these new variants. Of course, I'm talking about Cebu. They do testing immediately upon arrival instead of on the 7th day. Has there been any resolution that was met between the national government and the local government of Cebu regarding this?
Well, I think Cebu already agreed that they will follow the national protocol, which is testing on the 7th day. Remember, we used to test on the first day on arrival. That was our old protocol, and eventually we discovered some of these patients were able to go through the screen, and we had an outbreak in February in Pasay. These were really the returning Filipinos who had been tested negative, but by the time they arrived in their homes and communities, they were already exhibiting symptoms. So it seems they have gotten it either in the plane or in the long travel. So now the IATF moved the swab from arrival to actually on the 7th day. Initially, it was the 5th day. Then we moved it to the 7th day because the data showed that we were able to catch more on the 7th day. Now, Cebu wanted to do their own protocol, but this was not approved by the Department of Health experts, and they were asked to follow the 7th-day protocol and do a facility quarantine because they had a swab on arrival. If negative, they would do home quarantine, which was the dangerous part because if they turned out positive after 7 days, they would have already exposed their family and the community.
Right, Doc. Just want to clarify. I mean, you know, Cebu, we have spoken to the health officials there as well as government officials there, and they say that according to their data, there's very little difference between testing on the first day or upon arrival versus the 7th day. But you're actually saying that there is some variance in the data. We're just wondering how big is this variance?
Well, the chances of getting a false negative on arrival is actually higher. That's the scary part because you will let go of a patient that you think is negative on the swab test but will exhibit symptoms after several days. So then they have exposed several people after you release them. So the current protocol advised by the IATF is arrival, booking in a quarantine hotel, and on the 7th day, upon arrival, they will be swabbed. And if they are negative, they complete 10 days in the facility and they go home to complete 14 days, another 4 days at home quarantine before they finally move around in the community. So this is the safer alternative. I think lessening this will actually increase the chances of slippage, but also doing 2 swabs will be costly. Because if you do one on arrival and do one on the 7th day, I think many people will also complain because of the cost of such tests.
All right, very clear on that, sir. Now, Dr. Herbosa, you did mention, of course, 40 million vaccines arrived here. But there's also reports coming out of Indonesia that healthcare workers there, some 350 of them, were actually hospitalized. And these are healthcare workers that were fully vaccinated with Sinovac. And we know that Sinovac is, you know, one of the more common vaccines being given here. And a lot of people are alarmed over this development. What do we know about this so far? And what reassurance can you tell us? Can you share with us at the moment, Doc?
Okay. I've read that as news articles yet, so I'd really like to see the published peer-reviewed articles on really what the data is. So until I see the scientific data of really how many among the healthcare workers were infected, I'd like to see that before I comment. Because Sinovac, which is an inactivated virus, actually also protects one, even if you're a health worker, from severe or even death. But it's very poor in making you protected from mild illness. So I'd like to find out if many of those health workers they said were infected only suffered a mild condition. If they suffered a mild condition, then the vaccine did its work because it protected them from death or critical or severe illness. So that's why we're giving it to the healthcare workers to protect them from dying. But it really doesn't protect them from getting infected. That's why you still see them wearing the PPE, the face shield, and the face mask when they treat the COVID patient, even if they're vaccinated, because you can still be transmitted, but your case will probably be mild. So I think that's really dependent on how exposed you are to the patient you're handling. And we saw the similar situation in Brazil. So right now in the Philippines, I've not heard of any outbreaks among healthcare workers. In fact, it's become very low. And Sinovac has been very popular among Filipino healthcare workers. I was actually pleasantly surprised that many of them agreed to be getting the Sinovac after the data was shown to them that it prevents death and critical illness. So I'll wait for the published data and then analyze and then comment on the Indonesia situation.
All right, then we will reach out to you by then. Thank you so much for your time. We appreciate that and your insights. Dr. Ted Herbosa, Special Advisor to the IATF. Thanks, Doc.